Hi there, I see a hand. All right, well, I have noon, and so we are going to get started. I am Susan Thomas, and I am a consultant for Family Connections. I am a former special education director, special education teacher. I also worked at the State Department. And since I retired, I've been retired a little over 10 years. And since I retired, I have worked in the private sector. And I now do consulting for school districts. I'm also do some work with the Academic Alliance of South Carolina, housed at the University of South Carolina. I tell people I'm not very good at retirement. So today we're going to be talking about 504, and I am excited to share some things with you. It's not a very exciting topic, but we're going to kind of talk about what the law says and then what we really should see in best practice in our schools. 504 is a little bit more difficult to navigate sometimes in our special education law IDEA. And so I'm going to share my screen and we are going to get things rolling in just a moment. And if I can share my screen, let's see. Love technology when it works. All right. So one of the things I'll ask you to do, I can't see the chat box right now as I'm sharing. And so I will check for questions. And of course, I will ask my counterpart, Megan, if she sees something and wants to interrupt me, that will be fine. If you see something appropriate, that will be great. And we will get going. So most of you are familiar with Family Connections, our great parent training and information center that provides training to our families of children with disabilities. And I just feel so blessed to get to do this work with them and know the support that they give families and our school districts and educators across our state and agencies. So let's start talking about what we hope to do today. Hopefully by the time you have finished, you'll understand kind of the requirements of Section 504, which is part of the Rehabilitation Act of 1973, and then best practices for schools and the components of a 504 plan. And then we're going to talk a little bit about accommodations and how we navigate those accommodations. I always like to talk about we all use accommodations every day. I don't know about you, but I just bought a new rolling bag, book bag, because I decided that I was tired of being worn out carrying my book bag with my computer, especially when I take trips. And so I use that accommodation. We all use curb cuts. I don't live without a calculator. Um, I very rarely write anything because my handwriting is very poor. So I type almost everything. And then, of course, I always have to talk about we even have scissors and tools made for left-handed people. My husband is left-handed, and he talks about some of the things we have that are not made for left-handed people. So we get some tools that are. So we all use accommodations to remove different barriers that we have. And that's really what 504 helps us to look at. Hold on just a minute. So when we think about that in the educational world, Section 504 is the section under the Rehabilitation Act of 1973, which we call the American with Disabilities Act. It impacts all schools who receive federal funding from the U.S. Department of Education. So that means unless a school is receiving federal funding, they're not bound by Section 504. So if your child may be in a private school, that would impact that. They would not necessarily have to follow this, although I know many private schools honor those accommodations in their school settings. It is a civil rights legislation for persons with disabilities, and the intent is to prevent discrimination because of disability. And so when I think about 504 is all about discrimination. And I like this, and I very rarely, I try not to ever read from a screen, but I'm going to read this one. Discrimination is the exclusion from participation in, the denial of benefits of, any program or activity receiving or benefiting from federal financial assistance. Students may not be denied participation in or be denied benefit from services that are afforded to non-disabled students. So we have things that happen, and there are barriers that students experience that might lead to discrimination. I can think of a couple of things that I've experienced and seen happen in the past, but let's think about those possible barriers. Certainly, if students have disabilities that are physical in nature, if we have building barriers that prevent them from getting somewhere in the building, that is discriminatory. And a lot of our schools struggle with this because they're older buildings. They were built way before any of these things happened. And so we have to make sure that we have planned for and have a way to accommodate those students. We have students that have executive functioning issues. Their ability to organize and plan, they're neurological in nature, that are barriers to them being successful in school. We have students with health problems, and those issues can limit their participation in activities. And so we want to remove any of the barriers that we can. We have students with social and emotional issues and disabilities that are barriers to their success. I've had students who really and truly, just the size of some of our schools causes a lot of anxiety for them. Just the number of people, crowded hallways, those types of things. I feel that way a little bit sometimes when I'm in a really large, like high school, in the hallway during class change. And so these are all things that can lead to discrimination. In the chat box, if you have some others you'd like to suggest, I'd love for you to put them in there right now. If you can think of some other barriers that really can lead to discrimination. And I'll open up that chat box there for a minute. Does anybody have anything they'd like to add? If you want to unmute for a moment and say something, I'll be glad for you to do that.
Hi, I'm going to put my video on too so you can see.
Okay.
Okay. So I have trouble with getting someone to help my child eat. I don't know if that is something that, like you're describing. I come twice a week.
It could be.
Yeah. I try to go as often as possible to literally put food in his mouth. And then twice a week, he has chorus, which I am the one to help with because they didn't have any aid that could help him with that. And then I take him to breakfast. Otherwise, no one's going to help him go and get breakfast.
So we would want to talk about that might be accommodation, or they may need some more support. But it says there's different situations, but certainly any of those health issues, those are big things that we would look at. And some of that could be just related to some of their, skill sets that they have. And so those are things we would want to talk about. So let's move on and kind of talk about our main message for when a child has Section 504. This is the main message. No otherwise qualified individual with a disability shall solely by reason of his or her disability be excluded from the participation in, be denied the benefits of, or be subjected to discrimination under any program or activity receiving federal financial assistance. And I will give one example that I've heard just so you can think about it. We can't exclude students who have an accommodations plan from being in AP classes because that would be discriminatory because of their disability. We can't exclude them from participating, and I actually one time had this happen, from going on a field trip because there's not a wheelchair access on the bus that they decided to take. That would be discriminatory. And so this is all about discrimination. And so you want to think it's when you're preventing something from happening because that barrier of disability. So we have to get those accommodations. So what does this look like in schools? Well, we're going to look at what is the barrier and remove those barriers for learning and participating in academic activities. We do that through accommodations and sometimes through some services. So I have a friend who has a child with a hearing impairment who is on a 504 plan, and they have audiological services in their 504 because they need a sound fill system in the classroom. So the teacher wears a mic so that the child can hear. So that would be an example of a service that might be put in accommodations plan. Everything else that child is able to do. So how do we define disability under Section 504? It's different than it's defined in our special ed law. It's a physical or mental impairment that substantially limits one or more major life activities. It can be the record of somebody having such an impairment. So that could be something that we've known for a long, long time. Or if they're regarded as having such an impairment. And so an individual meets the requirements of being regarded as having such an impairment if they have established this under Section 504 and that it limits their major life activities. And I'll talk a little bit more about what that means as we go through. This is the list of what are the suggested major life activities: caring for oneself, performing manual tasks, seeing, hearing, eating. There you go. When we were talking about eating, that might be one of them. Sleeping, walking, standing, lifting, bending, speaking, breathing, learning, reading, concentrating, thinking, communicating, working. Whew, that's a lot of things. The thing is, it has to substantially limit. We all, if we say, we may all have problems with a few of these things, but it's the substantial limitation. And then of course we have the body functions. What are they defined as? And you can see these. I won't read them all to you, but any of these are considered those major body functions under Section 504. So when might a student need a 504? What we would consider is when the student's disability is such that it does not prevent the student from learning, first of all. So they can learn, they can be all those things in the general classroom, except they're having whatever their issue is, limiting their participation. And so they can learn, and the accommodations and services would remove the barriers and provide equal access. So otherwise, they're just fine, and we're going to give them equal access. It's really important for us to note that when students need additional and specialized instruction, related services, and modifications for the general curriculum, then the team needs to go ahead and evaluate for special education. And we can't ever, as I remind people, I've heard of cases where the school district may have evaluated for special education and the child was eligible and the parent goes, oh, I don't want to put them in special ed. Can I have a 504? You really can't do that. If they're eligible and need special education, the district is bound to provide those special education. They can't That's a compromise they shouldn't be making because they could get in trouble under IDEA. So anytime we're talking about a student who needs more, we need to move to evaluation. This is all about the barrier removal through accommodations and those services that help students. So let's talk about how does this happen? Well, we start with an identification process, and that becomes with a referral. The referral can be from you as a parent because you're concerned. It could be a lot of school districts do screening clinics and they might refer. We have multi-tiered systems of support teams that are problem-solving teams. That's part of that framework that they could be doing intervention with a student and decide that an accommodation would be appropriate and they refer. Could come from teachers, counselors. Sometimes we have agency members who are concerned and might recommend. I know many times we've had DSS. In my experience, some of our DSS support personnel have suggested that that might be something the school wants to look into as they're placing maybe a child in our care. And so those are anybody can refer. And so the way, if you're a parent and you want to refer, I always recommend you send a written letter or an email to the principal of the school stating your concern and the area of disability. So if you are concerned about your child's anxiety, you might say, you know, my child's been diagnosed with anxiety and I'm very concerned that they need some support. They're coming home and they're very upset every day and about some things going on at school. I'd like to talk about it. I think they need some support. If you have a documentation of the disability, always attach that. So if you have a doctor's, you know, if you've had a report done, an evaluation done, always attach that because that's important for the school to have. And then request a meeting to evaluate for a 504 plan. And so that's how we refer. And so what should happen next is the school should convene a team of people knowledgeable about the student and also people knowledgeable about the area of disability. So for example, if you have concerns about, let's just say your child has some hearing issues, we will want to make sure that somebody is in that room that understands that world of hearing and possible hearing impairments. Just like for my friend that I was talking about a little bit earlier, an audiologist was at that meeting. And so that's really important that it's not just teacher and an administrator, maybe a school counselor, but somebody that's knowledgeable about the area of disability that we're going to be talking about. A meeting should be scheduled and you have to be given written notice of the meeting that is in the law. And then when the team meets, they are going to review the current data and discuss concerns and then plan for evaluation. You do have to evaluate for accommodations under Section 504. That is in the statute. And so a lot of times I see people going in and they just write an accommodations plan and they don't do an evaluation, and the evaluation really should be done. That doesn't mean you have to test. And so we'll talk about that in a minute. So who should be on the team? The person knowledgeable about the impact of disability, the general education teachers who know the standards, curricula, and instruction, parents, of course, knowing the needs, and also any additional information they have. Sometimes parents may bring a tutor, or maybe the child's seeing a private counselor. Those people can certainly be included in the meeting. I like to have those people there. So we can get a holistic view of the child, the student, if appropriate. And I always recommend that once students are in middle and high school, they should be at the table. It's their plan. I'm fine with them being there in elementary school, but particularly as they enter adolescence, it is their plan. And we are trying to teach self-advocacy. So it is important for them to be there. And of course, we need a school administrator there because they are responsible to ensure the implementation of the plan. So that's who should be on the team. And then we're going to talk about concerns, and then we're going to collect data. And we could go into the meeting and have enough data that we can do the evaluation right there very quickly. So we may have enough sufficient information that we can determine eligibility, and we can determine what the appropriate services and accommodations would be. That's great. We're going to want to look at assessment data. We're going to want to look at current data, but we may decide we need additional assessment. So sometimes we actually need to do a little bit of assessment before we put an accommodation on a plan. And if we haven't done trials ahead of time, we might want to take some time to get an assessment. I know, and I keep using this example because it's one of the recent 504s I've been in, is they did a functional hearing assessment. So they did that after the meeting, they collected that data, and we came back together before we wrote the plan. Good 504s have good data. And if we don't have adequate data, then we need to make sure we take time to get that. You as the parent always must sign consent to use any data that we're bringing to the table for evaluation. So if we have reports, y'all, the parents have reports, all of that. And also you have to give permission for any additional evaluation to be done. So let's think about a child that maybe we are concerned about some of their social emotional well-being. And we decide in that meeting, you know, we really don't have anything except some observational things. Let's do some behavior rating scales. Maybe somebody's going to do an observation in the classroom additional. Then we would have to get permission to evaluate and do those things. It's very similar for those of you that are familiar with IDEA. It's the similar requirements there for evaluation. I do feel that a lot of schools sometimes skip this evaluation part and go straight to writing the accommodations. And it's really important that we have good assessment. I never like to put an accommodation in place without knowing, is it going to be kind of effective? Because then we've wasted a lot of time. So just things to consider. When we assess academics, just to kind of look at impact, we can utilize current assessment scores, grades, although remember, grades are our least reliable because they're very subjective. You can have a letter grade lost just maybe from not following directions, and that doesn't have anything to do with your ability to learn the content. Certainly, any information from parents, please share outside reports and services, any kind of direct observations of the student in the home. You know, if a parent tells me, you know, look, they're struggling so much and we start homework and we're still doing it 4 hours later, we need to know that. That's not normal. And that shouldn't be. And so what can we do about that? But remember that the team may want to go back and collect some additional academic data for diagnostic information. Always assess for accommodation use. I'm a big believer that we should utilize trials. And so we put a lot of accommodations in place that we have no clue whether they're effective. And so, and we don't want to over accommodate because that's not good. So here's my example that if you're wanting to put reading aloud on something, have the student take the quiz while reading it to themselves and then with it being read aloud. Is there a change? Was there a difference? Did it reduce anxiety level? Those are things we want to look at. This is not so the child can do better. This is to remove the barrier. And so we also always want to make sure what the student's perspective is on using the accommodation. I had a teacher in a training that I was doing just the other day, and they were saying that the student doesn't need the accommodation. It's a high school student. The student says they don't need it, and the parent still wants to leave it on there. Remember, our goal is to move students to independence. And if their perspective is that they are able to now manage it and they've developed strategies, which a lot of times as kids get older, if we're doing a good job, they've developed their own strategies. And so we want to remove those accommodations. as much as we can. A lot of people think more is better. That is not true. Less is more. We want to have those bang for the buck, the ones we know work. Um, and for students with the social emotional needs, will utilize current data like office discipline referrals. We might have a social emotional screening tool that we have given to all students that has raised some concern. Any outside evaluations, and then sometimes for students with behavioral concerns, we may need to go ahead and conduct a functional behavior assessment, or sometimes an assessment of executive functioning for some of those students who have trouble with those organizational planning type skills. It just depends on the needs of the student. So we get this evaluation done. We have all our assessment, and then we determine eligibility. So once again, we're going to have that team look at everything and determine the major life activity that's impacted, and then is it a substantial limitation? Now, here's where it gets tricky. The law doesn't define what substantial limitation is. It's made by that team on an individual basis. And it's really important that we work together and that we have this, we come to an agreement. And it is not just because one person wants it and another person doesn't. We have to come to consensus on this. It's not a vote. We have to determine whether this barrier is limiting their access to the activities. And so, will accommodations meet that need? And sometimes that's hard, and it's not as easy as it sounds. And I will say this, that you can do the evaluation, review the data, and determine eligibility in one meeting if you have all the information ahead of time. If you don't have all that information and need more, then that needs to be collected and the team comes back together to determine eligibility. Doctors cannot write prescriptions for 504s. They can't order it from a doctor's office, a medical doctor. They can ask that the child be evaluated to consider a 504. Some additional considerations for the team members. We always have to consider eligibility if the impairment is episodic. And I always think the one that I think of a lot is sickle cell. So sometimes the child needs those accommodations and some things, and sometimes they don't. We can't just say no because of that. And then we have to make this determination regardless of whether the child's having medicine. You can't deny a 504 if the child takes medicine or if the child is not on medicine. And so a school district can never say, well, we're not going to do a 504 because we know medicine would fix it. That will not stand up. And so, however, the only thing that we can kind of think of is the mitigating measures of eyeglasses and contact lenses shall be considered when we're thinking about does it limit a life activity. And I like to give examples of this. Is we had there was a student that had the term I call it because I have one, is a lazy eye. But it did not limit life activities. Yes, it was identified, and we chatted with the doctor about it to make sure if to see what that is. I'm going to take just a second. And somebody asked, could a child ever go from an IEP to a 504? Absolutely, you can do that, because when in fact that should be happening more than it does, and I'll talk about that in a little bit more about that. All right, back on track here. So just so you know, a doctor's diagnosis is not required for the team to determine eligibility. That's not required in the law. And also, just because you have a diagnosis or an identification of a disability doesn't automatically make the child eligible for 504. And so, because remember, we're saying, does it limit major life activity? Is it such a barrier that they are not able to do it? One of the things I always caution parents about, and we know this happens a lot, is we are over accommodating in our K-12 program. And when students are entering post-secondary, whether it be a technical school or a college, these laws don't look the same. It's not the same accommodations. And so the more we can have independence, the better off we are. Remember, when students enter post-secondary, they have to declare their disability, they ask for accommodations, and they can be denied. I dealt with a student not too terribly long ago that was asking for calculator use on an assessment, and it was denied by the school. And so we want to now, we went back and countered with some things, some more information on that one, because the child had always used a calculator, but we had to provide. So it's not just because they had it in high school, they're gonna get it in post-secondary. And so we want to be really strategic in what we do. So we've determined eligibility, so we're going to write a plan. If we determine that eligibility and say the child needs a plan, and we're going to have that same a team, including the parent and student, if appropriate, to determine reasonable accommodations and services. And that term reasonable is in there, and we have to remember it's things that we can do that will benefit the child. They're not there to make it better. It's there to remove barriers. And my screen doesn't want to go. Hold on. Reasonable is designed to address the area of concern and to meet individual needs. And then we may need to add some type of services. It just depends. I've had some students who had vision impairments that the service was basically providing things in Braille. So nobody actually saw them. We just made sure they had everything in Braille. And so some of those services are done by people on behalf of the student. So what needs to be included in a good 504 plan? And some of our districts in South Carolina, some of our districts have electronic systems with 504. Some of them are still using paper and that have the paper trail. And I would love to see us have a consistent 504 across the state. It would make life so much easier. So what needs to be included? The names and positions of team members, who's on the team, the description of the child's disability, and the major life activity that it impacts. Sorry, let me go back here. And a full description of the accommodation or services the students will receive. Who will be responsible for implementing or delivering the service? And when the service accommodations will be utilized. So it's really important that those accommodations be fully described. I've seen some that say, preferential seating. Well, what does that mean? Where does that child need to be seated? Is it in close proximity to the teacher? Is it away from, some kids have issues with background noise, and so we want to make sure they're not sitting near, a big air conditioning vent in a room, all of those things. We also have to remember that the accommodations can cover extracurricular activities. If a student needs an interpreter so they can participate in a club or in a sporting event, then that has to be provided. If the child is going to receive testing accommodations, a description of the allowable accommodations for each assessment should be on the 504 plan. And then for a student with behavioral concerns, generally we would see an attached behavior intervention plan.
Thomas,
Yes.
there's a question actually related to behavior from Charmaine. She was just asking if the bib is different from a 504 plan. If so, how? And if a behavior is not included in a 504 plan. So I was hoping you could speak to that as well.
So here's what I will always say about students who have behavioral concerns. The behavior, a functional behavior assessment should always be done. That is how we determine an effective behavior intervention plan. If we are writing, if it is behavior that is substantially limiting that child, then the behavior intervention plan should be attached. If some school districts might have some of that integrated into their 504, but I do not see that a lot, just like we don't with IDEA. It's like a separate document. Does that answer that, Megan?
I think so. Charmaine, let us know if you need additional information.
Thank you.
I just think that's the best practice. Because that's how we ensure that we're addressing the environment and all those things. There's always a caveat to everything I say. So let's just make sure we understand what accommodations are. And I love this definition. This is from the Iris Center, that is Vanderbilt University. They provide wonderful resources for us that are, as I say, free, and I love it. But I like their definition. It's a change to instructional or testing procedures or materials that allow a student to fully access the information and to accurately demonstrate knowledge. They do not change expectations for learning. The student is still expected to learn and participate. They don't reduce the requirements of the task. They don't change what the student is required to learn, but they do meet the unique needs of the individual student. And not all students that even might have the same disability have the same barriers. And so we have to look at those individual needs based on the assessment. So one of the things that I heard just recently, that somebody wanted to have that they could attend every field trip as an accommodation. That's not really an accommodation. That's something you want to work out with the school. Okay. These are things that are instructionally things that we're going to do, or environmentally that we would do. And the school is responsible for implementing those. I've had people put on 504s that the student will be allowed to take the test until they pass the test. That's not an accommodation. You've now modified what the child's doing. And so, those are not typical accommodations. However, breaking an assignment into smaller parts for a child that really has struggles with, organizing and getting things done, that might be an accommodation. Prompting a student would be an accommodation. Those are the types of accommodations that we see. And I put a little example here. The way we present information. I've had students that, I gave them guided notes before as an accommodation. That might be something that we do. How material is presented, how students can respond to information. Do we let them type instead of write? Can they verbally tell us instead of having to write it because maybe they have dysgraphia? Any changes that we make to the environment where we present any material or where students are, those are those things that we talked about a little bit earlier. And then timing and scheduling, extended time, or breaking things up into small chunks. A lot of people want to put extended time on there, and actually students don't need extended time. What they need is for us to manage their time for them. And so a lot of times we need to put schedules for them instead of just saying, oh, they have extended time. We need data to show that extended time is what they need. A lot of times we miss the boat on that one. I see a couple of things in the chat box, so I'll check it really quickly just to make sure. And I see an individual, I'll go back and pick up those individual cases at the end. Here's just a couple of examples for presentation. We might use large print. We might have notes and outlines, sign language. You can see on here some of the responses. We might have students mark in an answer book rather than use their computer, or allow them to use a spell check. You know, we have a lot of students that there's a lot of concern now about some of the computerized testing that, you know, I was just reading something recently that some students respond too quickly. So we may have some things that we put in place with that. Certainly our settings, any kind of special lighting, positive reinforcement, those kinds of things. These are just examples. They're not, this is not an exhaustive list. We have to know the child's needs, but that just gives you an idea. So when we're selecting accommodations, start out with what's the barrier, and that should be talked about. And then what are the child's strengths? Because we want to use the strengths to lessen the barrier. So for example, if a student has very strong oral listening, they have good listening skills, then providing auditory text for that student might be great. But if they don't have a strong listening comprehension, that's not going to be an appropriate accommodation for that child. It's not going to help. So we have to look at all of that. And this is true for students on IEPs too. And we want to determine whether the student would be able to utilize the accommodation to overcome the barrier. Can they even do it? I laughed one time because the accommodation was a technology system that the student was having trouble navigating. It was too difficult for the student. And so that's not going to be helpful. It might have been perfect for another student. That's why that assessment is so important. And then we want to make sure the accommodation is efficient and effective. And part of this, and I may have this later on, I can't remember whether I said this or not, but part of this is, does the student even want to use it? If they're not comfortable and don't feel this, that it's going to work, then we need to reconsider. They're part of providing the information to us. It is their accommodation. It's not even what schools think. It's the student really does. We have to watch how they're responding. We always, just some guidelines, make sure the need is supported by data, write clear accommodations, leave no room for interpretation, avoid any open-ended accommodations. And I gave an example, you know, preferred seating. What does that mean? Avoid accommodations that give teachers discretion. Be really careful about that. Using the words when needed can be really subjective. So, you know, be sure you define, and then make sure you clarify all terminology, and remember the 504 must be followed by all staff. And so we want to make sure all staff's aware of that. Just a word about testing accommodations. Students are able to have instructional accommodations on a daily basis that may not be allowed on some tests. We don't want to stop the student from having an accommodation just because it's not allowed in testing. I hope that makes sense, because we're wanting students learning, and we don't want to deny them that ability to learn because of a one-day test. So if you ever hear, well, we can't do that because it's not allowed on testing day, that shouldn't be. However, if we have a student who needs an accommodation for testing, they need to be using it in the classroom. And my favorite one that we do all the time is small group testing. And we do that on testing day, but we don't do it any other time when they're taking tests. And so then on the biggest testing day, which high anxiety day for kids, we sometimes move them to a group they've never been in with adults they've never seen who are administering those tests. And so be careful about some of those things. Small group, we need evidence to know that small group makes a difference. And that a lot of times is one of the number one, I think it's one of the number one accommodations. And those students are not in small groups any other time. And so that's really important to remember. Accommodations for non-academic areas, remember we have to provide those. I talked about that. That means if your child has an accommodation during the school day and they're in a school childcare after school, those same accommodations have to be there. Sporting events, field trips, all of those things. But remember, this is to remove barriers from participation and avoid discrimination. That's the reason for 504s. It's not to do anything else. That's why they started. We do have different types of services. Counseling certainly is one of the services that I see included on a lot of 504s, mental health counseling. I gave the example of Braille. Sometimes transportation, we have students that need specialized transportation, and then some behavioral services sometimes. Remember, if we're starting to think this child needs a lot of services, I always recommend that we probably want to consider evaluation under the IDEA. And I say this for many reasons. Number one, 504 is an unfunded mandate, which means there is no funding for people to do the services once a child goes on the 504. And so we're starting to talk about a lot of services. We've got to think about, okay, let's look at where we're getting that. But also the child may need more than just accommodations at that point in time. So 504 plans should be reviewed and updated annually based on data. And they do have to have a reevaluation. The law gives no timeline for evaluation. Most recommend a review every 3 years, just like IDEA, and a lot of school districts just follow that. School districts should have a procedure for this, and you can ask, what are your 504 procedures? And the team can always discontinue a 504 plan if it's determined it's no longer needed, but that doesn't mean the child still doesn't have a disability and that we can't come back in to add something later if we see that's not working. But as I said, many times as students get older, they develop some of those strategies themselves and they don't need a plan. But we certainly want them to have it if they need it. Just remember, assessing the use of accommodations before any kind of review. We want to look at, is the child using it? Does the student feel the accommodation is helpful? And is there a difference in their grades, their anxiety level, their on-task behaviors from this? And we really want to get this information from general education teachers because a lot of times that is where they're seeing the use of accommodations. And I go into a lot of meetings where there's an accommodation written and I'll ask why. And I will hear, because it's been on there since they were in 2nd grade. We should be assessing accommodations and changing all the time. Students are growing, they change. So every time you do a review at the annual review time, you should really say, is this something that's still working and still needed? And if it's not, take it off. I think about it as if you don't need to take certain medications anymore because the condition's taken care of, you don't keep taking them. And it's the same thing here. And we always want to use data. And part of that data is really talking to the student and teachers about how usable is the accommodation. Is it working? I want to talk about discipline under Section 504 for students. The district, if students are removed from school for more than 10 days, that's not 10 consecutive days, that is 10 school days, then they have to conduct what we call a manifestation for the student. And the manifestation hearing is to determine if behavior is related to the disability. I will tell you, if the student had drugs or alcohol, that is excluded under the protections of 504. If the behavior is a manifestation, then a functional behavior assessment, behavior intervention plan has to be developed for the student. But there is no automatic right for the student, a Section 504 student, to remain in the current placement if the behavior is related. Under the IDEA, there is a right that they can remain in the current placement unless the IEP team determines that's not an appropriate placement. I think we have to be really careful. Some of our students need more behavior support than a 504 provides. And so if we have students with significant behavior, we really do need to look to see if they are eligible under Section 504. Under the IDEA, because they may need much more support. You should always receive procedural safeguards in 504 meetings. You also have to get prior written notice. And I'll go over what should be in the prior written notice after the meeting before it's implemented. You have the opportunity to examine any records, and you have the opportunity for an impartial hearing if you are concerned about any problems with implementation of Section 504. A prior written notice has to be given for 504, just like it does for special education. And the prior written notice must be provided to parents within a reasonable amount of time before the date the team proposes or refuses to make any changes. Identify, evaluate, place, or provide a free appropriate public education to the child. That's part of Section 504, just like it is in IDEA, and we have some information on prior written notice. And this is what needs to be included in the prior written notice. I always tell people it's what are we proposing, or if we refuse something, if the parent's asking for something and we refuse it, we have to put that action in there, why the team proposes or refuses, and then a description of each one of the evaluations or any assessment or reports that were used to make that decision. And then did the team consider anything else? And are there some other factors that the team discussed that you want to make sure you put on the document? So prior written notice is just the same as it is under the Individuals with Disabilities Education Act for Section 504. The district has to have notices of non-discrimination in all of its programs and activities, and this is straight from the requirements. And school districts must identify the official responsible for ensuring compliance with Section 504. So they have to appoint somebody. Generally, when I've helped with procedures for districts, there's a front page that gives who the person, what the role of the person is. When I was special ed director, I was also responsible for Section 504. The district must have a grievance procedure. The district must provide a person to oversee those grievances, and the grievance procedures must incorporate the due process standards, so parent rights and a district policy concerning complaints and grievances. And so there is a process to go to the district when you are in disagreement or want to file a grievance. However, the administration of Section 504 is administered by the United States Department of Education Office for Civil Rights. And so state departments of education have no enforcement authority for issues arising under Section 504. So unlike special education, where you can file a complaint at the state level, or you can file a due process. If you have a complaint, you actually have to go through the OCR. And I put the link here, and we're going to share this PowerPoint with you where if you wish to file a complaint, you can go to that site to file it. I always tell you, please try to go through your local areas before you do that, because sometimes people in buildings don't understand that they violated Section 504. And so we always want to have an opportunity to try to fix that. People make mistakes every day, and the OCR process is pretty lengthy and involved. I've been involved in a couple, and we were able to resolve them pretty quickly. And really, if we had known, we could have fixed it without the parent having to fill that paperwork out. So always go to your district level first. You don't have to, by the way, but I recommend you try that. All right, I do have a video here, but we were having trouble getting the sound to play. But when we share this with you, this is a great little short clip on what are 504 plans that you can watch yourself. Oops, hold on. And we'll look at that. I want to talk about a couple of resources that we have for you, and I've downloaded these and we'll share them with you, a couple of them. But there's a parent and educator guide to Section 504, and that is a great document that has lots of questions and answers, and gives you a lot of information. Protecting students with disabilities, frequently asked questions about Section 504 and students with disabilities. That's a nice document from our Department of Ed. and that you might want to take a look at. And then this is just, if anybody's interested, this is a great little Section 504 online course if you want to learn more. And then understood.org has a nice, a brief page on 504 plans in your child that are available for you. I always like to provide resources so that you can learn more as you're going through. And of course, our Family Connections does a great job of helping and supporting you with 504. One of the things that I did not talk about was remembering if your child has an IEP, they don't need a 504 and an IEP. They are already covered through that IEP. So I'm not looked through all the questions, but
I have, that's great, Dr. Thomas. I appreciate the clarification because I always feel like that does come up. There was a question, so there's two individual situations that we wanted to get to. There were just some clarifying questions that came up. So one was, can you clarify the process by which a student obtains accommodations in post-secondary education, and is that also covered under 504?
So a student in post-secondary education, and certainly this is, I just know this, the student has to go to the disability center at whatever school they're at and declare their disability. And then this kind of starts falling under the American with Disabilities Act. And then at that point, they will request accommodations and it will be reviewed by the university and or school, tech school, wherever, to determine appropriateness and whether they're going to be allowed. And they also have a grievance process, but the student has to go and do that. The parent can't do it for them. They have to go themselves.
Important distinction. Thank
Yeah.
you. There was also a question about examples of behavioral services, and I believe that was when you were talking about maybe in the discipline section. But Angela, I don't know if you want to clarify, but just looking for examples, she was asking about examples of behavioral services.
So behavioral services could be mental health counseling. Certainly it could be, one of the ones that I've done a lot with kids is we've put in a check-in, check-out system for the student. That could be a behavioral service where the child's checking in with an adult during the day. We might put in mentoring for behavioral service. So it just depends on the child's needs. I did see somebody had put in there asking how about weapons? Well, weapons are, a whole nother ball game for all students, whether they're on a 504 or an IEP. That's a whole different ball game. The reason I differentiated about the drugs and alcohol is because with IDEA, they're not automatically excluded.
And there was a question about bullying, which I know there was some information that you had shared. So if you we want to make sure that we get that information out to you. So we've got your emails, but I thought there was a really helpful piece that you shared. But there was a question about from a mom whose daughter is struggling with understanding social interactions and being bullied, and any sort of accommodations that could be made to protect her in that situation.
Well, and I think what we would have to determine first is that a disability? Is this based because of a disability, or is this just a child who's struggling to understand that? And I always recommend that, if your child's struggling and it's not based on a disability, you need to call and talk with the school counselor, because a lot of the counselors do sessions. They do small group sessions with kids on different things that they may be struggling with. And it's not a disability, it's just who we are, And so always check with your school to see what kind of supports they might have, because there's just lots of groups going on. I had to laugh at my daughter. I have a granddaughter in kindergarten, and she's struggling with that there's some words that don't follow the rules for decoding. And she is really upset about it, you know? And so, you know, we have some kids that get upset about things, but it's not a disability and they have trouble understanding. So, you know, I would say differentiate that. Always call the school and talk to them. The counselor is a great place to start, the school counselor. Any other questions?
It looks like there was one more about services supportive of Head Start children and families related to behavioral concern.
I am not sure how Head Start. I'm not trying not to answer this, but I'm not sure how Head Start works with 504. And so, but I would say if there are behavioral concerns, those need to be brought to the school for consideration of, do they need services? And then what do those look like? We would want to see good behavior supports in Head Start, certainly. And I will tell you this, we have a South Carolina Partnerships for Inclusion, and if you're not familiar with them, they do a lot of work with those inclusive practices and behavior, and they do a lot of work with Head Start. Might be a good one for us to do something on, Megan.
That's
early childhood.
Yes, I was thinking that that one does come up quite a bit. So we've got a list of ones to plan for next year, which is hard to believe we're saying that. I did want to just let everyone know I've dropped the evaluation in the chat. I've also putting our 1-800 number in there as well. So if folks have additional conversation or additional questions from today's training and want to talk to one of our staff, they can certainly contact us that way. And I see, Sarita, I don't know that we got to yours.
I'm going back and looking at it right now. You know, I think I would always go to the school and express concern. Yeah, I just operate off of we're not going to wait for the child to fail to go in and get supports in place. So if you already know your child has a disability of hearing, I would go ahead, and what I always like to go in is, let's go in and let's have a discussion and determine, do we need to evaluate for 504, or do we want to go ahead and evaluate to see, does this child need more special education services? Don't wait. That's just my personal, as an administrator, I want to get on things before the front end. I don't want kids to struggle and then us start trying to play catch up. And so I would go ahead and ask for that meeting. And remember that we can't just use the child's grades and how they're performing to make that determination of impact. Because there are a lot of things to consider when we're doing that. We want to use multiple sources of data, not just the teacher says they're doing okay. Because, and particularly with young children, because we know our elementary teachers are very nurturing and they're also super duper supportive. And a lot of times the child's not really gaining the skills. And so that's why we want to look at multiple sources of data. I hope that answered your question.
I think we have time for one more. And I saw a question about an accommodation for a student who has tube feeding.
Generally that would go to services. Sometimes that might be nursing services doing that. And that would be on there. I mean, if the child didn't need anything else but that, or somebody that can deliver that service. Remember, services are part of what we have to make sure we cover. If that's something, that's certainly a barrier. And so if we're making sure, then we might put that in there. the same way, if we're having trouble with kids that have, just have trouble with things because of their disability health issues. I think about a couple of students that we had to, prepare food for. They were on, so just like a child on a gluten-free, think about that. If that's part of their issue, then we have to remove that barrier at school because lunch is an extracurricular activity. And some parents opt to send lunch, that's fine. But if you don't, then we got to kind of look at that, particularly if all children are afforded the opportunity to get lunch, you can't discriminate against them.
I see a couple thank yous coming through, so I just want to echo those. Thank you, Dr. Thomas, for your time today discussing 504s. This was really good information. And again, if you we didn't get an email from us, or you are looking for those additional materials that she shared with those links in the video, you've got my contact information to email me, or if you would like to talk to one of our family education specialists, you've got
Absolutely.
a number. So thank you so much, Dr. Thomas. Great information as always, and we look forward to having you on one of our next trainings.
All right. Y'all have a great Christmas. If you don't, break is coming soon.
That's right. All right. Thanks, everyone. Bye-bye.